most famous physical therapist on the internet.
Hi, folks. I'm Bob Short, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
So today, Brad, we're going to show the family and friends out there how to massage knots away from your shoulders, upper back, and traps. Basically up in this area here where they're very common.
Right. A very common place to have tension, knots, things that make you uncomfortable.
So knots are also known as trigger points, and they're very common, like we said, in this area. So I saw where trigger point was defined as a grumpy little spot.
Technical, huh?
Yeah, in a taut band of muscles,
Sure.
a tight band of muscles. And the tissue that hurts when you press upon it, and it maybe even reproduces the symptoms of pain that you're having.
Sure.
It might even spread out and cause it. So there's a lot of speculation about what causes knots and what knots are, and they really don't know. But we certainly think poor posture plays a large role.
Sure.
So, therefore, our recommendations are going to be both massage and also to correct and mobilize your posture.
Sure. Right.
So, you can use the following devices. You can use a tennis ball, a lacrosse ball. You can use a massage cane, and you could also use a massage gun. Brad, do you want to show a few of those?
Yep, we got two here.
And then the handheld massager.
Yeah, this one actually works. We'll talk about this one
how
in
that works.
in this application.
So the goal of trigger point massage is to apply a continuous pressure right to the knot, and it should be a pleasant pain. If it's too much, on a scale of 1 to 10, it's more than a 5. That's probably too much, and you're not going to do it right now.
If you say, "Oh, but it hurts," but it kind of feels like it hurts so good, that's typically a good sign you can continue to work with it to let it release.
Yeah, so you're going to get right on it. You're going to do short strokes on it. One direction. You choose the direction, what seems to feel best for you, but stick to that direction.
Because there's typically one right where my finger is there, and for me to get back there, I have to push here a little
elbow,
bit.
yeah.
And then I can do that directional massage like Bob was talking about. I can go forward and backwards, right to left.
Like about 12 strokes. During that time, you want to see the pain levels drop down. If they don't, you might not be on the right spot, or it may not be helping. This is something you could do throughout the day. You can do it 3, 4, 5 times a day. But 12 strokes is enough. Then you can go to another area if you find it helpful. That's why it's nice to have a tool. Right?
Yeah, and you're actually going to push pretty hard on those 12 strokes.
Yes.
And you're going to get right into the muscle and get deep and work that.
Now, we do have on another video the rules of massage. You may want to watch that because we don't want you massaging over a pulse. Like I want to put a tool right up on where the skull meets the neck. There's the vertebral artery there, and you could, who knows what you do.
Yeah, you just want to stay away from
the
pulses and where the blood flow is.
So one thing, Brad, just to mobilize posture a little bit, and very common to have that head forward, rounded out upper back posture. So what we recommend is you take a lacrosse ball or a tennis ball, and you're going to hit 6 spots. So Brad, if you were to lie down, you would lie down on a ball, put in one right here and let it work a little bit. Right here, we're going right down the spine, right between the shoulder blades. 1, 2, 3, 4, 5, 6. You can do it against the wall, or you can do it on the floor. You can't really do it on the bed. But you're going to work that area. And did you want to try one, Brad?
Yeah. So, again, just to make sure it's clear, you don't go directly on the spine. It's to the right or to the left in that muscle spot.
And you're not worried about trigger point here. What you're trying to do is stretch that spine out so you can correct your posture again.
And the wall works nice because I'm working that muscle, and I'm going to squeeze back and get my head back, and sometimes just feeling it allows you some feedback, so if your head is forward and it's stuck, you may not be able to touch your head, and it's not up like this. It's chin tuck in and work it that way.
Now, we know this video is about massage, but we felt it was important that you might get stuck if you don't address that issue.
Right,
if you don't correct that posture.
You loosen it up with the ball, and if you have poor posture, again,
it comes right back.
Knot's going to come back, and a lot of other potential problems.
So I'm going to show now, Brad, the massage cane. There's a whole host of these out there too. But what's nice about these, you can really get some leverage on this. So if I'm gonna hit a commonly found knot, like in the upper trapezius, I can grab the handle like this,
Yeah.
and I can really push in there, and I can do that massage across there,
Right.
just like, I don't know if you can see that I'm getting some movement there, but it's just a short stroke,
Yeah.
and oh, that actually feels good.
Oh yeah, it's
Like you said,
you
it
know,
hurts so good.
this takes away so reaching and pushing like I had mentioned before.
Yeah.
You don't have all of that discomfort of trying to get around the corner with. You wish you had maybe 3 elbows to get there, but so this takes care of that.
The massage guns are nice in that they're even easier on your hands, but you might need a partner if you're trying to get that area.
So that's where this particular style is a big game changer because you can,
You can hit the spot.
yeah, and without, and I can actually do it with both hands and work over that. Yeah, and you know, these just feel good. I mean, that's why these things are just have really taken off in the last few years because they work, and it's not near so hard.
The massage guns are more powerful than this one.
Right.
So if you have a massage gun or you get a massage gun, again, you might need a little assistance with if you want to hit the upper
Yep.
traps.
Family member, someone around the house, or maybe someone walking down the street, see if they'll
Yeah.
help you out a little bit.
But it'll certainly, you can use this, almost anywhere else on your body. And
Absolutely.
that's why they come in really handy from that. So, really, that's it. You're going to work those trigger points several times a day, get them down to the point where the pain is no longer
Yeah.
there, and then you got to maintain posture, and hopefully they won't come back then again.
Oh, I don't know if we mentioned it here, Bob, but if you are using one of these on this trap, and you start to go up on the neck, stay away from the neck. Don't go on the
good
spine
point.
of the neck. It's just too aggressive, and it's not comfortable for
It's
one
going to
thing.
rattle you.
Yeah,
it's going to rattle
it
your
makes a
bones.
whole because your eyes start to shake because it makes it look like there's a big earthquake, and it's not comfortable. Just stay away from the neck.
Yeah.
All right.
This video, by the way, is a part of a series of videos on massage. So if you want to see the whole series, go to bobandbrad.com, go to the the program section, and you'll find a program on massage. You'll also find one on sciatica, and you'll find one on plantar fasciitis and TENS. And,
Yep.
so check it out. Watch the videos that pertain to you. You don't
Yep.
need to watch them all because there's quite a few. And Brad, what do you want to add?
Yep. Look at them. You're gonna see a place that says, what does it say again?
Oh, it's a PDF.
PDF. Yeah, you click on that, and it'll print out a review and what the whole video is about, so you can go back and look at the printout to remember things from the video. The whole thing is absolutely free. We don't even ask for an email, so it's just a great deal for you.
Yeah, if you have senior moments like Brad and I, you can have that visual reminder of what to do.
That's
So,
exactly right.
all right. Thanks for watching.